Thank you for choosing the Joint Replacement Program at Roper St. Francis Healthcare for your upcoming joint replacement surgery. A total joint replacement can be a life-changing event, and we want to make sure you can get the most out of your treatment. This patient resource video is created to help you prepare for your surgery and learn what to expect during and after the procedure. The Joint Replacement Program at Roper St. Francis Healthcare has 9 orthopedic surgeons dedicated to joint replacement surgery for hip and knee. We operate Monday through Friday at all 4 of our locations: Roper Hospital, Roper St. Francis Mount Pleasant Hospital, Roper St. Francis Berkeley Hospital, and Bon Secours St. Francis Hospital. When you come to Roper St. Francis, you can expect highly skilled, compassionate doctors who lead the state in joint replacement surgeries. Whether you need treatment for your hip or knee, our goal is to get you back to the life you love as fast and as safely as possible. When you have to make the decision to have joint replacement surgery, you will be given a hip or knee notebook at your surgeon's office. Although this video is a short overview of the entire process, we encourage you to read the notebook from beginning to end, as it provides detailed information to further prepare you for your upcoming joint replacement surgery. Osteoarthritis is the most common form of arthritis, affecting millions of people worldwide. It occurs when the cartilage in your hip, knee, or shoulder joint starts to deteriorate. When this cushion or shock absorber wears down over time, you have bone on bone rubbing together, causing excruciating pain. To confirm your diagnosis, your physician will get an X-ray of the affected joint. Once your doctor has exhausted non-surgical options for treating osteoarthritis, such as over-the-counter medications, prescribed medications, and potentially cortisone injections, your next step becomes joint replacement surgery. At this point, you and your doctor have determined that surgery is necessary to relieve the pain and get you back to the activities you love. We understand that preparing for surgery can be overwhelming. That's why we consolidate your pre-op appointments as much as possible. Our team will organize your tests and pre-op procedures so you can get into surgery quickly and safely. Prior to your surgery, someone from pre-admission testing will call you to get scheduled for some lab work that needs to be done before your surgery. Please have this information ready for this call: your medical history, such as diabetes or COPD, your surgical history. The exact dates are not required if you don't know. List of current medications, that's over-the-counter and prescribed medications. Exact dosage and frequency taken. The list of medications you give is very important. It's given to the testing nurse, and with permission, you'll be given these medications during your hospital stay. You will also discuss your food and drink status with pre-admission testing, often referred to as NPO status, which means nothing to eat or drink after midnight before your surgery. If this isn't followed, your surgery must be canceled. Some medications will be allowed that morning with small sips of water only. When asked about alcohol consumption, please give an honest answer to this question. As you get ready to take a big step toward improving your quality of life, let's discuss infection prevention. Roper St. Francis Healthcare is committed to doing everything possible to protect your new joint and prevent infections. Health problems such as allergies, diabetes, and obesity could affect your surgery and your treatment. If you are a diabetic, make sure you are in good glucose control. You should seek clearance from the doctor that is treating you for diabetes. Make sure you don't have major dental issues that need to be addressed prior to surgery: abscesses, root canal, or loose teeth. If you are a smoker, it is highly recommended that you try to quit smoking 30 days prior to your surgery. Patients who smoke are at greater risk for infections. Talk to your doctor about options that are available for you to help quit smoking prior to your surgery. We also ask that you do not shave the extremity that you are having surgery on prior to your surgery as well. If you cut yourself shaving, you will create a source of entry for infection and your surgery will be canceled. It is recommended that ladies stop shaving their legs 5 to 6 days prior to their surgery. Your surgeon's office will give you a bottle of CHG, chlorhexidine gluconate, to bathe with. This is a sterile scrub that will come with instructions on how to use it. This is a 4-day scrub. The scrub should be started 3 days before your surgery, including the morning of your surgery, for a total of 4 days. It is a shower scrub only. You cannot sit and soak in a tub. With every scrub, you should use a fresh, clean, laundered washcloth and towel to wash and dry off with. The scrub will be used from the neck down to the toes, front and back, avoiding the private area. For the private area, we recommend you use an antimicrobial soap such as Dial or Safeguard. On the day of surgery, please bring the following: photo ID, preferably a driver's license if you have one, insurance cards, Medicare or Medicaid cards, power of attorney or a living will if you have one, but it's not required, a list of medications with the name of each medication, dosage amount, and frequency. The day after surgery, we prefer that you wear your regular clothes from home. Pants or shorts with an elastic waistband are highly recommended. Pullover short sleeve tops without a lot of buttons or snaps are preferred. The shoes you bring must have a rubber sole and cover the entire heel of your foot. The shoes you wear may be slip-on, lace-up, or Velcro over. Do not bring in flip-flops, Crocs, or Birkenstocks. This is a safety issue. Please make sure you bring your 2-wheeled rolling walker with you to the hospital. The physical therapist will adjust your walker to your correct height so it is safe for you to use. Make sure you label the walker with your name so it doesn't get lost or misplaced while you are in the hospital. This is the only piece of equipment you need to bring with you. Please arrive 2 hours prior to your surgery, unless your surgery is scheduled for 7:30 a.m. The admissions desk does not open until 6 a.m., so please do not arrive prior to that time. When you are finished with the admitting process, you will be taken to the pre-op area where they will get you prepped and ready for your surgery. The surgery itself, including recovery room time, will last anywhere from 2 to 2.5 hours. When you are done with your surgery, the doctor will contact your family or designated contact person to update them on the outcome of the procedure. While in the recovery room, your blood pressure, heart rate, temperature, and pain level will be monitored closely to make sure you are medically safe and stable to be transferred to your private room on the joint replacement unit. As with any surgery, there is a risk of complications. Joint replacement is no exception. Pneumonia is a concern since you have been lying flat for an extended period of time and have had anesthesia. The best thing we can do to prevent pneumonia is to get you up and moving and walking as soon as possible. All patients will have a TriFlow incentive spirometer in their room. The nurse will show you how to use this device correctly. We recommend that you use the TriFlow incentive spirometer at least 10 times every hour while you're awake. This device will help keep your lungs expanding and will assist in moving the bad air out of your lungs and the good air in. Blood clots are also a risk. To help prevent blood clots, you will be asked to do an exercise that we call ankle pumps. This is an exercise where you will be instructed to pump your ankles up and down 10 times every hour. This exercise assists in pumping the blood from the bottom of your feet up toward the level of the heart to keep blood circulating so you don't form and develop a clot. You will also be wearing an SCD, a sequential compression device, to assist in the prevention of blood clots. This device consists of a felt sleeve that fastens in place with Velcro. The sleeves are placed on the lower legs while you are in the recovery room. When you arrive to your private room on the joint replacement unit, the sleeves will be attached to a machine at the foot of your bed. This machine will inflate and deflate the sleeves, compressing the blood vessels in the lower legs to keep the blood circulating and flowing to prevent a clot from forming. Every patient will receive a blood thinner in the form of either a pill or injection. The type of blood thinner you receive depends on who your surgeon is and what his or her preference is. If you are currently on a blood thinner, that blood thinner is usually restarted per your routine at home. After any type of surgery, it is common to experience a certain amount of pain. Joint replacement surgery is no exception. Although we will never get rid of the pain completely while you're in the hospital, it is our goal to keep it to a minimum. We use a pain scale that goes from 0 to 10, with 0 being no pain and 10 the worst possible pain. Our goal is to keep you at a 4 or less on the scale. Although you might be experiencing some pain at a level 4 or less, the pain is usually not so severe that you can't tolerate your physical therapy. We have worked very hard on a pain management regimen that involves the use of narcotics, non-narcotics, and anti-inflammatories to assist in the process of controlling your pain with great success. In addition to pain medication given by mouth or IV, our total knee replacement patients will also have an On-Q pump. This pump consists of a small catheter that is inserted under the tissue of the skin in the upper thigh area and will lay alongside the femoral nerve. This catheter will be placed while you are in the pre-op area. The medication in the pump is a numbing medicine, not a narcotic, known as ropivacaine. The pump will be started in the recovery room and is good for 3 days, 72 hours for infection control purposes. The goal of this pump is to continuously drip numbing medicine alongside the femoral nerve to assist with knee replacement pain and expedite your physical therapy. When you're discharged from the hospital, you will be instructed on how to discontinue the use of the On-Q pump when you go home. The On-Q pump is for total knee replacement patients only. This is due to the location and placement of the catheter and would not benefit our hip replacement patients. We will also use ice packs that will be placed at the incision site to assist you with your pain management as well. Please know that your safety is very important to us. To keep you safe on the joint replacement unit, you may not be on your feet by yourself. You must have a nurse, physical therapist, occupational therapist, or patient care tech with you always, no exceptions. This includes going into and out of the restroom, getting in and out of a chair, or in and out of bed. We have bed and chair alarms in place to help keep you safe from falling. Please make sure you ring your call bell for assistance when you need to get out of bed or the chair. Physical therapy starts the day of your surgery. It is our goal and the doctor's preference that every patient is up the day of their surgery with physical therapy. Physical therapy is twice a day. After your morning session, it is recommended that you stay up in your recliner until you have had your afternoon session. Your therapy will consist of walking outside your room and around the nurse's station. You will practice going up and down stairs, and you will be taught exercises that you can perform independently at the bedside. Your physician or physical therapist might recommend that you be seen and treated by an occupational therapist. They will assess how well you perform basic activities of daily living, such as bathing and dressing. If recommended, occupational therapy starts the day after surgery. The goal is to ensure you are safe and performing basic self-care activities as independently as possible. The average length of stay for joint replacement surgery is usually 1 to 2 days. This is common across the country. Our number one goal is that you are safe upon discharge. If at any point in time the nurse, physical therapist, or your doctor feels it is not safe for you to go home, we will not discharge you. Our joint replacement team offers a fast-track program where patients are discharged the same day of their surgery. There is strict criteria that must be met to be considered for the fast-track program. If this is an option you would like to consider, please notify your doctor so he or she can plan accordingly. Your case manager will see you the day after surgery to discuss your discharge plan. As soon as the doctor feels you are medically ready and safe from a physical therapy standpoint, he or she will discharge you home from the hospital. While you are in the hospital, our staff will provide care for you. When you go home, your family or friends will be providing support. It is recommended that you always have someone with you, but it's not necessary. If you feel that it is not safe to return home after surgery, then you might consider a rehab program. The 3 acute rehab centers in the Charleston area are Roper Rehab Hospital in downtown Charleston, Encompass Health, and Trident Rehab, both in North Charleston. To go to one of these acute rehab programs, you must meet criteria. If you would like to consider this option, please let us know. You will need a PPD, which is a skin test to check for tuberculosis upon admission to be considered for a subacute rehab. You can also find more information on our website when considering a subacute rehab facility. If you plan to return home at discharge, we will work with you to plan for your home health physical therapy that will come to your home upon discharge. This is the first step toward your recovery at home. You may choose any home health company that serves your area and accepts your insurance. We can provide a list that meets these requirements. Your orders for physical therapy will be 3 times a week for 1 month. They will work with you if you meet homebound criteria, and this is defined as a taxing effort to leave the house on your own, an inability to drive yourself, and have the required need for physical therapy. They will plan to see you within 48 hours of discharge from the hospital. When therapy determines it is safe to transition you to an outpatient setting, they will work with you and your physician to assist with this transition. And just a reminder, you will need a front-wheeled rolling walker. You should get your walker prior to surgery through your doctor's office. If you have any questions regarding your upcoming surgery, please feel free to contact the Patient Care Coordinator, Sandy Wilkin, at 843-724-2149. Thank you for choosing the Joint Replacement Program at Roper St. Francis Healthcare for your upcoming joint replacement surgery, and we look forward to working with you to ensure you get the most out of your treatment.